Welcome to the deep dive. We think a lot about the food we eat, where it comes from, how it tastes, but how often do we really consider the invisible world that interacts with that food, or even lives inside us?
That's a great point.
It might actually surprise you, maybe even alarm you, to learn that microbial diseases hitting our digestive system are the second biggest cause of illness in the U.S., right after respiratory diseases.
Yeah, the numbers are pretty staggering.
We're talking something like 76 million cases every single year. That's huge, isn't it?
It absolutely is.
So today, our mission really is to dive deep into this, well, fascinating and sometimes, frankly, alarming world. We want to explore the big concepts, the microbial processes, the body structures involved, and, the real-world impact of these illnesses. We're pulling our insights straight from a key microbiology text, basically giving you a shortcut to being well-informed, maybe with a few surprising facts along the way.
And it's such a crucial area because, our digestive system isn't just plumbing, it's this bustling, dynamic microbial ecosystem. From the second food enters, it's interacting with just massive populations of microbes. Some are allies, some are just sort of hanging out, and then unfortunately, some are pathogenic.
The bad guys.
Exactly. It's this constant interplay. And a really key concept for a lot of these illnesses is something called the fecal-oral cycle,
Okay.
which immediately tells you why sanitation, clean food, safe water, these aren't just nice things to have, they're absolutely fundamental for public health everywhere.
Okay, let's unpack this then, right from the beginning. What exactly is our digestive system?
Sure.
I mean, fundamentally, you can think of it as this long, winding tube, right? The GI tract. Starts at the mouth, goes all the way through.
Pharynx, esophagus, stomach.
Stomach, small intestine, large intestine. But it's not just the tube. There are these accessory structures too, like salivary glands, liver, gallbladder, pancreas.
Yeah, all adding their essential juices.
Exactly. Pouring in secretions to break down food into molecules small enough for our body to actually absorb and use.
And what's really fascinating is how the microbial landscape changes as food moves along that path.
How so?
Well, your mouth is like a microbial city. Millions of bacteria in every milliliter of saliva. It's teeming.
Wow.
But then you hit the stomach with that harsh hydrochloric acid and the small intestine where things move really fast. The microbe numbers drop way down. Relatively few can survive or hang around.
Okay, so it gets tougher for them.
Right. But then you reach the large intestine and boom, it's a population explosion. We're talking over 100 billion bacteria per gram of feces.
100 billion per gram.
Yeah, it's estimated that microbes make up maybe 40% of the weight of feces, mostly anaerobes, thriving without oxygen.
That's just incredible. So they're not just passing through.
Not at all. And here's the really interesting part. These aren't just freeloaders in your large intestine. They actually do vital work for us.
Like what?
Well, they have enzymes that help break down polysaccharides from plants that we can't digest. And they synthesize useful vitamins like certain B vitamins and vitamin K that our bodies need.
So they're actually helping us get nutrition.
Exactly. And maybe even more profound is their interaction with our immune system. Something like 70% of our entire immune system is located right there in the gut.
70% in the gut.
Yeah, in what's called gut-associated lymphoid tissue, or GALE. Our normal, friendly gut microbes basically train this immune system. They teach it to tolerate them, the good guys, while also producing their own antimicrobial compounds and even signaling our own cells to produce antimicrobials like defensins. It's this constant, delicate negotiation, sorting friend from foe.
That really changes how you think about your gut, doesn't it? Less like a passive tube, more like an active border zone.
Absolutely, a very busy border.
So when does that balance get upset? Let's start right at the entrance, the mouth. We talked about millions of bacteria there.
Yeah.
What goes wrong? Like with cavities.
Right, dental caries or tooth decay. And you touched on something important earlier. Teeth are unique. Unlike skin, which sheds cells constantly, taking microbes with them.
Teeth don't shed.
Exactly, they're non-shedding surfaces. This lets microbes build up these sticky communities called biofilms, what we know as dental plaque. And a major player in starting cavities is Streptococcus mutans. It's a gram-positive coccus, and it's kind of a triple threat.
Right?
It can metabolize lots of different carbohydrates. It tolerates acid pretty well. And this is key. It uses sucrose, table sugar, to make this gummy substance called dextrin.
Dextrin.
Yeah, and that dextrin is like the glue for plaque. It lets the bacteria stick firmly to the tooth.
Now, sugar isn't just food, it's building material for the plaque.
Precisely. Then S. mutans takes that sucrose, breaks it down, and ferments the fructose part into lactic acid.
Acid, that sounds bad for teeth.
It is. That lactic acid directly attacks and demineralizes the tooth enamel. This is why snacking on sugary stuff between meals is so damaging.
Ah, because your saliva doesn't get a chance to neutralize the acid.
Exactly. Saliva helps, but constant sugar exposure overwhelms it. Now, other bacteria like lactobacillus species help the decay progress deeper, but S. mutans really gets the party started.
And if it gets through the enamel?
It moves into the dentin and eventually the pulp. That's where the nerves and blood vessels are.
Yeah.
Then you're looking at things like root canals to save the tooth.
Makes sense. So prevention is really about limiting sugar, especially between meals, breaking up that plaque with brushing and flossing, and fluoride.
You got it. Minimize sucrose, disrupt the plaque mechanically, get professional cleanings, and use fluoride to strengthen the enamel. Pretty straightforward, but incredibly important.
It really highlights how specific microbes interact with our diet. Okay, besides cavities, what about gum disease? Periodontal disease.
Right. Periodontal disease is basically inflammation and breakdown of the structures supporting the teeth.
So not the tooth itself, but what holds it in place.
Exactly. The early stage is gingivitis. That's just inflammation of the gums. You might notice bleeding when you brush, usually caused by a mix of bacteria, streptococci, others.
Is that serious?
It can be if it's not treated. If gingivitis progresses, it becomes periodontitis. This is chronic, often painless at first, but it destroys the bone and tissues holding teeth, leads to loose teeth, even tooth loss. Bacteria like Porphyromonas are key players here.
Oof. Painless sounds dangerous because you might not notice it.
It can be insidious.
Yeah.
And then there's a really nasty acute form called acute necrotizing ulcerative gingivitis, or ANUE, sometimes called trench mouth. Very painful, foul breath. Prevotella intermedia is often involved.
Trench mouth. Sounds historical, but still relevant?
It is. All these show that oral health is really integrated with overall health.
Okay, so let's move down from the mouth into the lower digestive system. You mentioned earlier this crucial distinction between infections and intoxications.
Yeah.
If you break that down again, it seems really important.
Absolutely critical distinction.
Yeah.
An infection is when the actual live pathogen gets into your gut and starts multiplying there. Think invasion.
Okay, the bacteria are setting up shop.
Right. Because they need time to grow. The incubation period is longer, maybe 12 hours, maybe up to 2 weeks. And since your body is fighting a live invader, you usually get a fever. Shigella, Salmonella, classic examples.
Got it. Longer incubation, fever, likely infection. So what's intoxication?
Intoxication is different. Here, you ingest a preformed bacterial toxin that's already present in the food. The bacteria might have grown in the food earlier, made the toxin, and maybe even died off.
Ah, so the bacteria themselves might not even be alive when you eat the food.
Correct. But the toxin is there. Because the toxin is ready to act immediately, symptoms hit fast, often within, say, 1 to 48 hours, and fever is less common. The classic example is Staphylococcus aureus food poisoning.
So sudden onset, maybe no fever, think toxin.
That's the general rule of thumb. Common symptoms for both can include diarrhea, maybe dysentery if there's blood or mucus, and gastroenteritis is just inflammation of the stomach and intestines. These are often the body trying to flush things out.
And for treatment, especially with severe diarrhea.
Oral rehydration therapy is paramount, especially in places without easy access to IV fluids. Just replacing lost water and electrolytes is life-saving. Zinc supplementation often helps too.
Okay, that distinction is super helpful. Let's apply it. Here's a clinical scenario.
Yeah.
Dinner party, 7 people. 3 of them get sudden nausea and vomiting, maybe some diarrhea starting just 1 to 4 hours after eating. It lasts about a day or two. The other 4 people who skipped the New England clam chowder are totally fine. Turns out the restaurant kept that chowder warm, around 39 Celsius, for hours before serving. As a public health investigator, what's the prime suspect?
Okay, key clues. Very short incubation period, 1 to 4 hours. Predominantly nausea and vomiting. Specific food item linked. warm storage temperature. This screams staphylococcal food poisoning.
Caused by the Staphylococcus aureus toxin.
Exactly. S. aureus enterotoxin. It's a major cause of gastroenteritis. S. aureus itself is common nasal passages, skin, easily transferred to food.
Right.
And S. aureus is tough. It resists heat, drying, high salt. So if food like that chowder sits in the danger zone temperature-wise,
Like 39 Celsius.
yeah, perfect incubation temperature. The bacteria multiply and pump out the enterotoxin. And here's the crucial bit. That toxin is heat stable.
Meaning reheating the chowder wouldn't destroy the toxin.
Correct. Reheating might kill the S. aureus bacteria, but the toxin remains active and makes you sick. The fact that it's usually not fatal in healthy people also points to intoxication rather than a systemic infection.
So the prevention is all about.
Proper refrigeration. Keep hot foods hot, cold foods cold. Don't let things sit at lukewarm temperatures.
Makes total sense. Okay, now let's switch to actual bacterial infections where the bugs multiply inside you. What are some heavy hitters there?
Well, let's start with shigellosis, also called Bacillarial dysentery, caused by Shigella species. A key feature is its reservoir, mainly humans and primates.
So it spreads person to person easily.
Very easily, often through the fecal-oral route, and it takes a very small number of bacteria to make you sick. They invade the intestinal lining cells, multiply inside, and produce shigotoxin, which causes tissue damage.
Leading to that severe bloody diarrhea dysentery.
Exactly. Plus cramps and fever. It usually stays in the gut, rarely gets into the bloodstream.
Okay, what about salmonella? We hear about that a lot with chicken and eggs.
Right, salmonellosis or Salmonella gastroenteritis, caused by various Salmonella enterica types. Unlike Shigella, Salmonella has a huge animal reservoir, poultry, reptiles, cattle, so it often comes from contaminated meat, eggs, sometimes produce.
How does it cause illness?
It invades the intestinal lining, multiplies, and can sometimes spread into the lymphatic system or bloodstream. They can even replicate inside our immune cells, macrophages.
Sneaky. What are the symptoms like?
Usually nausea, abdominal pain, cramps, diarrhea, and a moderate fever. The incubation is a bit longer than staph poisoning, typically 12 to 36 hours.
Generally not life-threatening for healthy adults.
Usually low mortality, less than 1%. Higher risk for infants and the elderly who might develop septic shock. Oral rehydration is the main treatment. Antibiotics usually aren't needed for simple gastroenteritis.
And prevention is?
Good sanitation. Proper cooking chicken needs to reach 74 degrees C, ground beef 71 degrees C, and refrigeration. This brings up that clinical focus case study about Salmonella puna on cucumbers.
Right, cucumbers. How does salmonella get on produce?
It can happen in the field, maybe from contaminated irrigation water or during processing and packing if surfaces aren't clean. Salmonella doesn't really grow on the cucumber, but if it gets contaminated, it can survive.
So washing produce thoroughly is really important.
Absolutely. Even if you peel it, wash the outside first to avoid transferring bacteria.
Okay. Is typhoid fever related to this?
Yes, typhoid fever is caused by a specific, more virulent serotype, Salmonella typhi. And here's a critical difference. Its only reservoir is humans.
Only humans.
Only humans, spread through contaminated feces. That's why improved sewage and water treatment has made it much rarer in developed nations. It's a much more serious systemic illness.
Wow.
S. typhi multiplies inside phagocytic immune cells and spreads throughout the body, spleen, liver. Then it gets into the bloodstream. Symptoms are high fever, headache, often diarrhea later in the illness after a long incubation of 2-3 weeks. It can cause intestinal ulcers, even perforation.
And the carrier state, like typhoid Mary.
Exactly. About 1-3% of infected people become chronic carriers, harboring S. typhi in their gallbladder, often without symptoms, but shedding bacteria and potentially infecting others. There is a vaccine for travelers or high-risk groups.
Wow. Okay. Another major one often linked to contaminated water is cholera, right?
Yes, cholera caused by Vibrio cholerae, specifically certain serogroups like O.1 and O.139. It naturally lives in brackish, salty waters, estuaries, sometimes forming biofilms on tiny crustaceans called copepods.
So it's in the environment.
It is. It spreads to humans mainly through contaminated freshwater, fecal-oral route.
Sure.
It's sensitive to stomach acid, so you usually need a pretty large dose.
And what does it do?
It produces a powerful exotoxin, cholera toxin. This toxin makes intestinal cells pump out enormous amounts of water and electrolytes.
Leading to the characteristic.
Rice water stools. It's shocking patients can lose 12 to 20 liters of fluid a day. Massive dehydration, shock, collapse, vomiting. Usually no fever, though. Untreated. mortality can be 50% or higher.
20 liters, that's terrifying. Treatment must be rapid rehydration.
Absolutely essential. Intravenous fluids are best, but oral rehydration is crucial where 5E isn't available. Doxycycline can help in severe cases, but fluid replacement is key.
This connects directly to that big picture discussion on cholera after natural disasters, like the Haiti earthquake.
Precisely. When water and sanitation systems break down, the risk skyrockets. Oral rehydration solution packets become lifesavers, stockpiling vaccines, promoting hygiene, but the long-term solution is always robust water and sanitation infrastructure, like the CDC's WashH program aims for.
And they even tracked the Haitian strain back to Nepal.
Yeah, genetic tracking showed it was nearly identical to a strain circulating in Nepal at the time, likely introduced by relief workers. Shows how globally connected these things are.
Incredible detective work. Now, E. coli normally lives in our gut harmlessly, right? But some strains are really nasty.
That's right. Most E. coli are harmless commensals, even beneficial. But certain strains have acquired genes that make them pathogenic. A major one we worry about is enterohemorrhagic E. coli, EHC, especially serotype 0157H7, also called STEC for Shiga toxin-producing E. coli.
Shiga toxin again, like Shigella.
It produces a very similar toxin, Shiga-like toxin. Cattle are the main reservoir, and here's a scary fact. The infectious dose is tiny, maybe fewer than 100 bacteria.
Wow. What does it cause?
It causes hemorrhagic colitis, severe bloody diarrhea, and in about 5–10% of cases, especially young children, it leads to hemolytic uremic syndrome, HUS. Yeah, it causes blood cells to break apart and leads to kidney failure. It can be fatal. Prevention involves cooking ground meat thoroughly, preventing contamination of leafy greens from runoff, and hand washing after contact with farm animals.
Which brings us back to that clinical case with Anna, the little girl at the petting zoo.
Exactly. She developed STEC 0157 infection. The investigation found the same strain in the deer, goats, and sheep there.
So she likely got it from touching the animals or maybe contaminated surfaces?
Yes, direct contact or indirect contact via fomites, contaminated bedding, fences, even clothes. It really highlights why hand-washing stations are absolutely non-negotiable at places like petting zoos.
Such a simple measure with huge impact. What about other problematic E. coli?
There are others like EPEC, EIE, EAEC, causing various forms of diarrhea, especially problematic in developing countries and for travelers. Travelers' diarrhea itself is often caused by ETEC or EAEC, but Salmonella, Shigella, Campylobacter, viruses, protozoa can also be culprits. Oral rehydration is key.
Let's talk about Campylobacter. You said it's a leading cause of bacterial diarrhea.
Yes. Campylobacteriosis, caused by Campylobacter jejuni. Leading bacterial cause in the U.S., over 1 million cases yearly. It's a gram-negative, spiral-shaped bug.
Where does it come from?
Primarily poultry. Studies show almost all retail chicken is contaminated. Also, unpasteurized milk. Interestingly, it doesn't usually replicate in the food, but survives well enough to infect.
Spims.
Fever, cramping abdominal pain, diarrhea, which can sometimes be dysentery, usually resolves within a week.
But there's a serious potential complication.
Right. In about 1 out of 1,000 cases, it's linked to Guillain-Barré syndrome.
The temporary paralysis, how?
It's thought to be an autoimmune reaction. The immune system, fighting Campylobacter, mistakenly attacks components of peripheral nerve cells because of molecular mimicry. Parts of the bacteria look similar to parts of our nerves.
That's frightening. Prevention again sounds like cooking chicken thoroughly.
Absolutely. Cook chicken thoroughly, pasteurize milk. Basic food safety.
Okay, one more big bacterial one. Ulcers. We used to blame stress, right?
We did. But the discovery of Helicobacter pylori in 1982 revolutionized that. It's now known to cause most peptic ulcers.
How does it survive in the stomach acid?
It's spiral-shaped and produces an enzyme called urease. Urease breaks down urea into ammonia, which is alkaline. This creates a little non-acidic cloud around the bacterium, neutralizing the stomach acid locally and allowing it to burrow into and colonize the stomach lining.
Clever little bug.
Very. It causes inflammation, leading to ulcers. People with type O blood seem more susceptible. And worryingly, chronic infection is a major risk factor for gastric cancer. It's classified as a carcinogen.
Is it treatable?
Yes, thankfully. Treatment usually involves a combination of antibiotics plus acid suppressors. Eradicating H. pylori typically leads to the ulcer healing and not recurring. Diagnosis can be via biopsy during endoscopy or non-invasively through urea breath tests or stool antigen tests.
Good to know there's effective treatment. Are there others we should briefly mention, like Yersinia or Clostridium?
Sure, Yersinia gastroenteritis, Yersinia enterocolitica, often comes from pork and has a unique ability to grow at refrigerator temperatures, which can be an issue for stored blood products.
Right.
Symptoms can mimic appendicitis.
Grow in the fridge. That's unusual.
It is. Then there's Clostridium perfringens gastroenteritis. It's an anaerobic, spore-forming bacterium, often associated with meats, especially stews, that are cooked and then cooled slowly. The spores survive cooking, germinate as it cools, and produce toxins when ingested. Causes milder diarrhea.
Spores are tough.
Very. And related is Clostridium difficile-associated diarrhea, or C. diff, another spore former. This one is notorious in healthcare settings. It often takes hold after antibiotic treatment wipes out the normal gut bacteria.
So antibiotics can paradoxically lead to this infection.
Exactly, by disrupting the normal protective microbiota. C. diff can cause severe, potentially life-threatening colitis, especially in the elderly.
A major hospital-acquired infection then.
Definitely. And one more, Bacillus cereus gastroenteritis, also spore-forming, common in soil, often linked to rice dishes, especially fried rice left at room temperature. Spores survive cooking, germinate, produce toxins, can cause either a diarrheal or a vomiting syndrome, depending on the toxin.
Rice. Who knew? So many bacterial threats.
It's a busy field.
Let's shift gears then. What about viruses affecting the digestive system? You said they operate differently.
Right. Viruses generally don't reproduce in the gut contents like bacteria might. They need to get inside our cells to replicate. Often targets are organs associated with digestion or the cells lining the tract.
Like mumps?
Exactly. Mumps virus enters via the respiratory tract, but its classic symptom involves the parotid glands, salivary glands, causes that painful swelling, fever.
You'll remember getting the MMR vaccine for that.
And that vaccine is why it's much rarer now. But complications can be serious inflammation of the testes or chitis, potentially causing sterility in males, meningitis, pancreatitis. It spreads through saliva even before symptoms show.
Okay, what about hepatitis? That's liver inflammation, right?
Correct. Hepatitis just means liver inflammation. Several different viruses cause it. Common symptoms are loss of appetite, feeling unwell, fever, maybe jaundice, yellowing of the skin and eyes.
Let's go through the main types. Hepatitis A.
Hepatitis A, HAV, is typically transmitted fecal-orally. Contaminated food or water. It's quite tough. Resists chlorine disinfection. Symptoms are often mild or absent in kids, but adults can get nausea, diarrhea, fever, abdominal discomfort. Good news. No chronic form, and there's an effective vaccine.
Okay, fecal oral. What about hepatitis B?
Hepatitis B, HBV, is transmitted differently primarily through blood and body fluids. Think contaminated needles, sexual contact, mother to baby during birth.
So bloodborne. Is it more serious?
It can be. Many infections are subclinical, but about 5–10% become chronic carriers, especially if infected young. Chronic HBV is a major cause of liver cirrhosis and liver cancer globally. Over 350 million carriers worldwide.
Wow. Is there a vaccine?
Yes, a very effective genetically engineered vaccine, now part of routine childhood shots. Prevention also involves safe sex, not sharing needles. There are antiviral treatments for chronic infection.
And hepatitis C?
Hepatitis C, HCV, is also primarily bloodborne, historically linked to blood transfusions before screening was available, now often associated with shared needles. It's often called the silent epidemic.
Why silent?
Because symptoms can be absent or mild for decades, maybe 20 years or more. But during that time, liver damage progresses. A very high percentage, maybe 85%, develop chronic hepatitis. It's now the leading reason for liver transplants in many countries.
And vaccine development is hard.
Extremely challenging. The virus mutates rapidly, evading the immune system, so prevention relies on avoiding exposure. Thankfully, newer antiviral drugs offer very high cure rates now, but they are expensive.
Are there other hepatitis viruses? D and E?
Yes, briefly. Hepatitis D, HDV, is an odd one. It can only infect someone who is already infected with hepatitis B. It needs HBV to replicate, makes the HBV infection worse.
So the Hep B vaccine protects against D too?
Indirectly, yes. And hepatitis E, HEV, is transmitted fecal-orally, like Hep A. Usually similar symptoms, but it has a worryingly high mortality rate, over 20% in pregnant women. No chronic form generally, more common in areas with poor sanitation.
Okay, so various types of hepatitis target the liver. What about viruses causing the common stomach flu or gastroenteritis?
Right, viral gastroenteritis. This is incredibly common. Two main players.
Rotavirus.
Rotavirus used to be the most common cause, especially severe diarrhea in young children. Symptoms are low fever, vomiting, watery diarrhea for about a week. Spreads fecal-orally, very infectious.
It used to be.
Yes, because thankfully there's now a highly effective live oral vaccine given to infants. It's dramatically reduced hospitalizations from rotavirus by like 98% in places with good vaccine coverage. A huge public health success story.
That's fantastic news. What's the other main one?
Norovirus. You hear about outbreaks on cruise ships and schools, nursing homes.
Ah, yes, norovirus.
It causes vomiting and/or diarrhea, usually lasting 2-3 days. Also, fecal-oral transmission, incredibly infectious, maybe as few as 10 viruses can make you sick, can spread via contaminated food, water, surfaces, even aerosols from vomiting.
Aerosols. Yikes.
Yeah. And it's notoriously hardy, persists on surfaces like door handles, elevator buttons. Alcohol-based hand sanitizers aren't always fully effective.
So what works?
Thorough hand washing with soap and water is critical. For surfaces, chlorine bleach solutions are needed. There's no vaccine currently.
Good to know. Soap and water it is. Okay, we've hit bacteria and viruses hard. What about other types of microbes like fungi, protozoa, or even worms?
Right, we shouldn't forget them. Fungal diseases of the digestive system often involve ingesting mycotoxins, toxins produced by fungi growing on food.
Like moldy food.
Exactly. 2 historical examples. Ergot poisoning from Claviceps purpurea fungus growing on rye grain caused vasoconstriction, leading to gangrene and hallucinogenic effects, linked to the Salem witch trials possibly.
Wow.
And aflatoxin poisoning from Aspergillus flavus, a common mold on peanuts and corn. Aflatoxin is a potent liver carcinogen, contributing to liver cancer, especially in parts of Africa and Asia. Highlights the importance of proper food storage.
Definitely makes you look twice at moldy bread. What about protozoa?
Protozoan diseases often come from ingesting dormant resistant cysts or oocysts found in contaminated water or food.
Like Giardia, the beaver fever.
Exactly. Giardiasis, caused by Giardia intestinalis, a flagellated protozoan. You get it from contaminated water. The cysts resist chlorine, often from streams where animals like beavers have contaminated it. Causes prolonged diarrhea, gas, malaise, weight loss. Filtration or boiling water is needed for prevention.
So chlorine doesn't kill the cyst.
Not reliably at standard concentrations. Another important one is cryptosporidiosis from Cryptosporidium. Also spread via water contaminated with oocysts, often from animal waste. Caused huge outbreaks in cities when filtration failed, as oocysts are tiny and chlorine resistant. Causes cholera-like diarrhea, life-threatening for immunocompromised people.
So water treatment needs more than just chlorine sometimes.
Yes, filtration, UV light, ozone are often needed. There's also amoebic dysentery, amoebiasis from Entamoeba histolytica. Cysts are ingested, trophozoites emerge in the intestine, and they actually eat intestinal tissue, causing ulcers, abscesses, and severe bloody dysentery. Can be fatal.
Okay, those sound nasty. Finally, what about worms? Helminths?
Helminthic diseases. These are caused by parasitic worms. Infections can range from asymptomatic to severe.
Like tapeworms from meat.
Yes, tapeworms. You get them from eating undercooked meat containing the larval cysts. Beef tapeworm, Tenaria saginata. Pork tapeworm, Tenaria solium. Fish tapeworm, Diphyllobothrium latum, from raw fish like sushi.
What do they do?
Adult worms live in your intestine, often few symptoms with the beef tapeworm, but the pork tapeworm is dangerous because if humans ingest the eggs, not the cyst, the larva can develop in us, migrating to muscles, eyes, or brain. That's cysticercosis, and neurocysticercosis can cause seizures. Proper cooking kills the larva.
So cook your pork well.
Absolutely. Then there are nematodes or roundworms. Pinworms are common, especially in kids. Tiny worms, eggs laid around the anus cause itching, spread easily through households.
Itchy kids. Got it.
Hookworms are fascinatingly creepy. Larvae in contaminated soil can bore through your bare skin.
Through the skin.
Yep. They travel to the intestines, attach and feed on blood, causing anemia and lethargy. Common where sanitation is poor and people go barefoot.
Wearing shoes helps prevent it.
It does. Ascariasis, caused by Ascaris lumbricoides, is one of the most common worm infections worldwide. Huge worms, up to 30 centimeters long. You ingest the eggs from contaminated soil or food. Larvae migrate through the lungs before settling in the intestines. Usually live off digested food, but large numbers can block the intestine.
Good grief. And finally, trichonellosis.
Trichinellosis, from Trichinella species. You get it from eating raw or undercooked meat, typically pork or wild game like bear, containing the encysted larvae. These larvae then migrate from your gut and encysted in your muscles. Causes fever, muscle pain, swelling around the eyes. Severity depends on how many larvae you ingest. Cooking meat thoroughly is key. Freezing pork helps kill T. spiralis, but not all species.
Wow, what a tour through the microscopic and not so microscopic threats to our digestion. It's just incredible, the diversity and the impact. From bacteria using sugar to decay teeth, to viruses silently damaging the liver over decades, to worms migrating through our
It
bodies.
really underscores the complex, delicate balance, doesn't it, between our bodies, our immune systems, and this vast world of microbes we live with and within.
Absolutely. It seems that despite all our medical progress, these diseases are still major challenges, especially globally.
They really are, and so much of it comes back to fundamentals. Clean water, sanitation, food safety, hygiene, plus continued research, surveillance, and vaccine development. Understanding these pathogens, how they spread, how they cause disease, it's the foundation for preventing them.
Definitely a powerful reminder. So next time you think about your gut feeling, maybe also think about the complex microbial world contributing to it. Thank you for joining us on this deep dive into the microbial diseases of the digestive system.
A pleasure.
Until next time, keep exploring, keep asking questions, and stay well informed.